Welcome to CyberCast, decoding today's cyber issues. I'm your host, Nikki Henderson. Today we're chatting with Keith Busby, the Acting Chief Information Security Officer at the Centers for Medicare and Medicaid Services. He will discuss the key objectives of the CMS Cyber Integration Center. Keith will also talk about the steps the agency's security engagements teams are taking to protect sensitive data and systems from ransomware, as well as the goals CMS is trying to achieve with its risk management strategy. Hi there, Keith. Thank you so much for joining us on the show today.
Hi, thanks for having me.
I wanted to start off by asking, do you mind giving a brief description of your role at CMS? And could you also outline some of the agency's top cyber priorities?
Keith Busby. I am currently the Acting Chief Information Security Officer, CISO, for CMS. I also serve as the Information Security and Privacy Group Director under the Office of Information Technology. For a strategic priority standpoint, some of the areas that we are focusing on is, increasing our data governance posture and capabilities, and continuing to head down the path of ongoing authorization or continuous authorization so that we can take away that kind of manual burden of our systems of the point in time assessments, while also increasing our security and risk posture assessments through doing continual assessments of all of our systems. One like sector-wide priority of ours is to continue to find ways to help the health sector as a whole, which is one of our nation's critical infrastructure or critical sectors, increasing their cybersecurity posture. And so we're looking at any way that we can further kind of tee that up in our contractual requirements or discussions with them, and support of all of these external entities increasing their security programs. As you've probably seen in the news, the healthcare sector has been under attack at large over the last year, and we hope to help this sector kind of improve its resiliency.
There has been a lot in the news about that ransomware and other cyber threats. Well, Keith, what is the CMS Cybersecurity Integration Center? And can you talk about some of its key objectives as well as its overall mission?
So the CMS, called CCIC, CMS Cybersecurity Integration Center, it's a program that covers a variety of areas. So it supports our cyber threat intelligence area, our cyber data analytics, our forensic malware analysis team. It covers our incident management team. It does our incident response and breach response. It covers our pen testing team, our internal pen testing team, which includes some red team activities. Covers our security engineering staff, and it's also our the SOC, which is the top tier SOC for CMS. And so from a program mission standpoint, the function is to have a consolidated program to cover all of these variety of areas to support all of the CMS enterprise. And so while the security engineering folks may not work on a specific system, they do support a lot of the background infrastructure that supports all of the enterprise capabilities and toolings that we have out there. So that, and I had mentioned that our SOC is the top tier SOC. That's because other systems and other offices within CMS may have their own SOC that work more on a day-to-day, minute-to-minute monitoring of their systems, and all of that feeds up for us to be able to do overarching cyber activities.
Perfect. Well, continuing our conversation about the CCIC, it is comprised of multiple security teams such as red, blue, and purple engagements. Can you provide some type of overview of the collaborative efforts between the different teams and what steps are they taking to secure sensitive data and systems against ransomware?
I'll start with the red team. So our red team, the primary focus is finding a way to disrupt that system, to shut it down.
Mm.
And so our red team engagement is usually a longer activity. It's more thorough, it's more in depth, with the sole intention of finding a way to take that system down. And so we are leveraging that to really stress test some of our systems and find those breaking points within the hopes of, we find them first so that we can fix it. And then some of the blue team pen testers, right? They're the ones that are doing our internal assessments. They work with the system teams to get an understanding of the system in advance, to see how it's laid out, to see where all the interconnections are, and then they go through a variety of different testing tools and methodologies to see if they can find any vulnerabilities or findings. And then the purple team activity comes from both sides, the red team and blue team, work with the system team and the SOCs and all the monitoring capabilities on top of that to find out, was it seen? If not, what do we need to do to be able to see these activities from occurring and to stop them from occurring?
Thank you so much for explaining that. Now I'm going to move into the risk management strategy. Can you talk about a little bit what that is, and what are some of the main goals that CMS is trying to achieve with this approach?
So from risk management, I touched on one of our strategic priorities, which is continuous or ongoing authorization. It's
Mhm.
our method of assessing and authorizing CMS systems. And so with any system, there's inherently some amount of risk. And so the RMF is in place to manage that risk, right? You can accept it, transfer it, mitigate it,
Right.
whatever it may be. And that's our approach to it. And so we're trying to move away from these point in time assessments, these overly manual, burdensome kind of assessment activities, whether it's controls assessments or a risk assessment, and move it into through continuous assessment. So leveraging something like Audit Manager for AWS to continually check subsets of controls within our AWS based systems, using vulnerability scanning and using, if you're storing your code and Git, using secret scanning and all these various enterprise level technologies that we can layer into it to ensure that we're getting insight and visibility into the risk posture of the system without having to have, these formal sit down and meetings and artifact creations to be submitted and reviewed by someone manually. All that takes time, it takes resources, it takes money, and we're trying to kind of streamline these activities.
Well, with the evolving threat landscape, organizations should definitely take steps to make sure that their infrastructure, their frameworks are more resilient. So, can you discuss some of the things that healthcare organizations should prioritize when it comes to boosting their cyber resiliency?
So HHS has published their CPGs, the cyber performance goals. And I think this is a perfect place for healthcare organizations to start, right? And so I would immediately, you should have the essential goals in place and covered. So mitigating known vulnerabilities, email security, MFA, multi-factor authentication, ensure that you're doing cybersecurity training, implement strong encryption, revoke credentials of workforce, departing workforce, so account management, incident planning and preparedness, ensuring that everyone is using a unique credentials. You should never be using shared credentials, separating a user and a privileged account, and then starting to implement SCRIM, so supplier cybersecurity requirements, supply chain risk. The ultimate goal would be going for the enhanced goals, which is asset inventory, so third-party risk management, third-party incident, more in-depth cybersecurity testing, cybersecurity mitigation. You want to work on detecting, responding to relevant threats, tactics, techniques, and procedures. Network segmentation. So you get into zero trust and networks microsegmentation. That's where you want to start heading down that path. Do centralized log collections. So I had mentioned that CMS, where the CKIC is the top tier SOC for CMS, use that as a centralized log collection point so that you're ensuring that visibility across the entire enterprise is at a single point. And then more of a centralized incident planning and preparedness, ensuring that everyone is on the same plan, same track, same understanding, and then configuration management. And all of these things can get mapped back to various NIST controls that government entities are required to implement. But even then, for those in the health sector, if they're doing a different framework, whether it's high trust or whether it's CSF or the CIS, all of these controls can be mapped back to every other framework. And so these are the capabilities that everyone should be working towards.
Thank you. Thank you so much. Well, Keith, how do emerging technologies like artificial intelligence help CMS when it comes to protecting patients' health and financial information?
So I can't sit here and say that we are doing anything right now with AI
Mhm.
around that. It's too early. There's too many unknowns, and there's a lot of capabilities that need to be put in place before you start leveraging AI to do some of that more in-depth work. I think leveraging it right now to do some of the manual work, some like note creation, summarization, doing gap analysis. I think all of that is a reasonable use case for AI right now. I think from making decisions based off of healthcare data, I think that's a little aggressive. I think it's worth exploring, but AI tool is only as good as the data it is trained off of. And so we need to make sure that the data we're supplying to it doesn't have any poison, any inherent bias, any of these issues that you can see within an A model, especially when it comes to healthcare data. Right? Having you know a prescription automatically created for a patient based off of some data that has been supplied to it, while it sounds great, there's also concerns around that, right? Whether the model has been trained properly, whether it's making the right decision, whether it knows all the external factors that go into it. So I don't think we are there yet.
Understood. Understood. Well, are there any future cyber initiatives that you're excited to talk about?
For me, I'm excited about where we're headed with increasing, and this sounds a little simplistic in terms, but increasing our data governance, continuing down the zero trust effort. These are all things that we're doing to ensure the confidentiality, integrity, and availability, ultimately the CIA triad of the American people's data, right? So that is what we are charged with, protecting our citizens' healthcare data. And so we are implementing all these things to make sure we have a good inventory, to know where our capabilities need to be improved, to ensure that we have visibility, that we're increasing our defense and depth practices to make sure that we're securing this data to prevent the ultimate incidents that seemingly keep coming to happen. That's more of a CMS focused thing. From a healthcare sector thing, I enjoy the engagement with our healthcare partners and the entire industry and seeing what we can do, what we've learned from all these various attacks, and seeing what we can do to help the sector at large become more resilient. Because as we saw with Change Health, when an incident to a healthcare provider happens, it can directly impact patients, right?
Mhm.
So
Right.
patients were unable to get care, they were unable to get prescriptions, and it just had huge sector-wide implications. And if we can help other organizations, whether they're small or large, improve their practices and ultimately learn from each other. I'm not going to sit here and say that we know everything, right? And so I think it's important to understand that we can all learn from each other to improve the entire sector at large.
Great. Great. Thank you so much for that. Well, before we conclude, Keith, do you have any final remarks or comments that you would like to add?
That's a loaded question, especially right now with lots of turmoil. For a long time, cybersecurity has not always had a seat at the table or has been properly funded. And I think that mindset is starting to shift. So I would just like to encourage everyone to bring your cybersecurity professionals in earlier, let them have a seat at the table, let them be engaged in the business conversations, and then cybersecurity professionals out there realize that we should be a business enabler, not a stopgap, right? And not a choke point. We only exist because the business exists, and we're here to help them.
Great, great. That is perfect. Well, Keith, I really appreciate you taking out time to speak with me today and discussing the latest cyber initiatives going on at CMS. I really enjoyed our conversation, and I hope that you have a great rest of your day.
Thanks, you too.